of our beautiful daughter, Amy. Amy was born full term. We had a beautiful little girl. She interacted well.
Do it. Go ahead. It's just unbelievable, just the magnitude of what this means not only to my family, to the city of New York.
Huh? What? What? Really? You're kidding. Who told you that? Who told you that? Mama told you that, huh? Wow.
She rolled over when she was 3 months old. We knew she was an epileptic. She had seizures early on, but they did not interfere with development. Everything was going fine. There she is, blue around the mouth. That would happen often. But she was doing great. She would eat everything we put in front of her without any problem. We were so blessed. Just lucky, lucky parents. Here she is, smiling at Daddy. She did that often, still does. Daddy's one of her favorite things in the world. Just a happy little baby. She sat up at 6 months. She walked at 10 months. She reached all developmental milestones. She didn't even really use a pacifier that much. And we fell in love the minute we got her. She had seizures, like I said, mostly myoclonic. And when she'd run a fever, she'd have a bad seizure. And it wasn't fun, but as you can see, it did not hinder any of her development. She reached all of her milestones on time.
And singing.
Here she is singing, watching Beauty and the Beast.
It's July 7th.
She was walking with Daddy, gone to get the mail. We lived across the street from the park. We lived on Eglin Air Force Base. Oh, she could run even as a toddler. She was just the most adorable thing. She still is. She loved balloons. She would chase after them. I think all toddlers love balloons. Just a little girl living her life. She waved to Mama. She was 2 years old. All brown eyes. She spoke in sentences, and then it happened. Everything fell apart. She woke up one morning, and she was spinning. The doctor said it was autism. We didn't know much about autism at the time. We would be on the fast track to learning. She went into a special school called Circle of Friends for autistic children, ABA therapy, speech therapy, occupational therapy. She liked to spin. If Amy was awake, she was spinning, and she was often awake. She had ADHD, OCD, sensory processing disorder. She was in constant motion. I think her favorite thing to do was to stand on her head. We were thin from chasing after her. We never left her alone. She could get hurt. She didn't understand the rules that govern society, as autistic children don't. We grieved, but autism was an umbrella of protection. It was not a roof over our head, and we just felt we could overcome with the right therapies, the right help, and we were going to get it, and we did. We did. she was happy. And there she is, back standing on her head. Something she did most every day, all day, if she wasn't spinning. She didn't need physical therapy. There was no hypertonia or hypertonic, nothing like that. She had good coordination.
Ice cream, Daddy.
That's right, you tell Daddy, ice cream, Daddy.
Ice cream, Daddy.
And how about cookie?
A cookie.
How about, what's your other favorite food? Milk.
And then our recovery happened.
Who's that?
Boots.
Is that Boots? Very good.
Slow and over time, she started coming back. The spinning stopped.
Who's that? Dora. Very good. That's it. Try it. Go. Dora. And what does Boots say? Can you tell me what Boots says? You are good. We practiced that monkey. We got that monkey down. 3, 4, 5, 6, 7, 8. Oops. No, you don't have to be sorry, baby. That's 8, 9. Okay.
At 4 and 5, she was talking well. She played video games. She had a Nintendo DS, an Xbox.
It's recording. Go ahead.
We were still dealing with the movements and the dystonia, and they could happen anywhere, anytime. But she was standing up straight and smiling and a happy little girl. She played soccer for 3 years. She was on the swim team. She played baseball, and she was a bowler. And she also sang in church, and she was learning to play the piano. Everything was on track. We had overcome autism. We won. She was drinking out of a cup, feeding herself.
Out, girlfriend.
I can only imagine it will be like when I walk by your side. I can only imagine what my eyes will see when your face is before me. I can only imagine.
These Elvis videos are wonderful. She's got it down.
I can play it on the piano too.
Surrounded by your one will
I don't watch all these videos.
We still had dystonia and seizures and posturing, myoclonic, but it wasn't hindering development yet. We were recovering.
Yes, you might. Are you having fun?
Yes, I am. The long thing on top. Look, a little thing that I can put my foot in right there. Can you help me get over there on the other one?
Go play. I'm not getting on that playground.
How old are you, Amy?
I'm trying to get the
Okay, how old are you, Amy?
I think no.
On July 8th of 2009, she woke up. She couldn't remember her date of birth, her address, her phone number, her age. The seizures started hitting her hard. This was in Epcot, Lunch with the Princesses, atypical absence seizure. She had no memory of having lunch with the princesses. She had trouble staying awake. Her pupils would be huge when she would be having a seizure. So we weren't sure if these episodes were seizures or just some sort of sleep disorder. We had a long-term video EEG, and they were seizures. This is a partial complex. They could happen anywhere. This was an altered state of awareness. I couldn't get her to speak to me or look at me. We had to have the G-tube placed. Here she's going to have a drop seizure. She's fixing to lose tone. Grover kept her from falling. Autonomic dysfunction, non-convulsive status epilepticus. These would wind us up in the hospital long term. She just couldn't seem to come out of them. They would use medications. The doctor suggested the vagal nerve stimulator. That's what happened here. She had that placed. Didn't help. Our poor child. Our sweet, sweet child. A seizure can happen anywhere at any time and look like any odd behavior. These are partial complex. She'll stick her tongue out. There she goes. Pupils are huge, unresponsive. In the car, we had overcome autism. We had won. We had a recovery, only to be slammed by whatever this was. The doctors said it was Lennox-Gastaut syndrome. We'd never heard of that. In her sleep, she'd jerk. Awake, she'd jerk. Sometimes the jerks would make her drop what she was holding or even fall on the floor. Todd's paralysis. And then this, dystonia, but the dysautonomia. She had trouble sweating. We're in the hospital because she gets stuck.
You fell down, honey. Honey. Amy.
Atypical absence seizures. These would often evolve into a full-blown tonic-clonic seizure and wind us up in the ER. And it wasn't like she had a fever or something. Everything was really good.
How good do you think it will look like?
I think it's going to be beautiful, just like you.
Uh-oh.
Okay, good. Don't fall.
Good thing I have a mama.
It's a good thing you have a mama. It's a good thing I have a little girl, because otherwise I wouldn't have a birthday today. That's right, and that's how old you are, isn't it?
I remember Tristan is 11 now.
He is?
Yes. Now that me is 11, Tristan is 11.
That's right. So good. Happy birthday, Princess Amy. Say happy birthday, Mama.
Happy birthday, Mom.
It's not my birthday, goofy girl. It's your birthday, goofy.
The walking happened so slowly. She went from running,
Classroom.
talking to,
This is Applejack. She is the big sister of Apple. I don't have her yet. I only have the.
Wait. You're talking to Nana.
Hi, Nana. This is Victoria. And I could make you
A picture. You can make her a picture, draw a picture on your new tray.
I was about to say that.
That's what you were trying to say, I know.
And I can make a picture of me and Nana.
she had atrophy. One leg was growing, the other wasn't. Then she started standing bent and stooped and hunched. There was atrophy in her brain. The MRI changed she would fall for no reason. Our beautiful daughter. She needs the wheelchair now. She can't walk. But she's still happy. She's still that bright, beautiful little girl. She's just a ray of sunshine. And we love her so much. I just don't know how this happened.